Well, you heard Steve Brown moments ago. Missouri voters are considering today whether to buck the federal health care law requiring individuals to buy health care insurance or pay a fine. These are live pictures we're getting back from Missouri. But it is not just that state that's considering this step. Arizona, Florida, and Oklahoma all expected to have similar measures on the ballot come November. Nancy Skinner is a syndicated radio talk show host, and she's my guest now. All right, Nancy, so those three states so far are going to put measures on the ballot that basically say, should we have a law in this state that says the feds can't force us to force people to buy insurance? And, Virginia already did it. Missouri's looking at it today. 3 more states are going to do it in November. My question to you is this going to wind up being an issue like gay marriage was back in 2004 that's going to bring voters to the polls who feel passionately about the issue?
Well, it probably is being done for political reasons, Megan, because it's not being done for legal reasons. It will be stopped in court. So what other reason would Republicans have to bring this to the ballots and to get people angry about their perception of our health care reform plan?
Well, what about states' rights? I mean, are you so sure it'll be struck down as unconstitutional?
Yeah, absolutely. Even Charles Freed, who was Ronald Reagan's Solicitor General, said he would eat his brew hat if the Supreme Court struck this down as unconstitutional.
Well, what about Neil Bortz's jacket? Has he seen that? Yeah,
I know Neil Bortz, and I would not want to eat his jacket. But no, really, you're a lawyer. You know, when it comes to the Constitution here, and that reason, no, it's almost impossible. I can't even envision any scenario in which the Supreme Court would strike this down.
Okay, so let's assume that's right. I mean, there are other legal opinions out there, and certainly the folks in these states who are behind the measures don't agree with that. But let's assume you're right, that these probably won't pass constitutional muster, these laws, if they're passed. To me, it's an interesting issue because, you know, they talked a lot about how, you know, folks got out to the polls back in '04 because they were galvanized on the issue of gay marriage. In fact, they opposed it, and they were concerned about all these ballot initiatives, and they wanted to make sure that, you know, that gay marriage wasn't approved. And that was one way in which Karl Rove got a lot of right-leaning voters to the polls. And so my question to you here is, you know, whether you like it or you don't like it, could this become the next tool that's used to get sort of healthcare opponents, or opponents to that law anyway, out to the polls? And how effective would that be?
I would say that if people are deceived about what's really in it, that would be an effective political strategy. But the reason it passed in the first place, Megan, is because, you know, we do have this problem, and here is a solution that brings down for our long-term deficits. It's the only thing that's really going to tackle our long-term deficits and lower our premiums overall. You know, I don't want to have to pay for somebody who can pay for health insurance, but they just don't want to. They're going to go be a freeloader and get that health insurance. But I'm paying $1,000 extra a year in premiums for a family and $420 for an individual because somebody just simply refuses to. We're not going to deny them health care. We're not going to say, you know, you're going to die. So.
But now you're sort of re-arguing the arguments behind the health care law, because what I thought was interesting at the beginning of your statement was you said sort of the reason this was passed is because this is how we feel. And the reason these efforts in Missouri and Arizona, these other states, are interesting is because if you recall, you know, the polling was virtually never, maybe I don't even need virtually, never on the side of the administration when it came to health care. You know, consistently
the very beginning.
Okay, so but pretty consistently.
6, 8 months.
Okay, but pretty consistently.
Even you had a majority of Republicans supported it.
But let me just make my point, because that's
the death panels.
I want to get to the point, and then I'll get you the chance to respond. Because, like, take a look at the latest poll. We had a Rasmussen poll that we talked about yesterday. Even now, just 32% of those polled believe that this health care law is going to be good for the country. 57% say bad for the country. Then you say, is that an outlier? You go to realclearpolitics.com. It's averaging around 37% who believe that this is going to be good. 37%. So it's nowhere near the majority who don't like the law. So what's interesting to me is you've got sort of the average voters now weighing in as opposed to their elected representatives. Go ahead.
I always think there's fear of the unknown. And when this was first introduced, I mean, we've been trying to fix healthcare for 60 years. When it was first introduced, there was great support for this bill. And as I was going to say, even among 55% of Republicans supported this bill. But with the constant fear-mongering that went on about death panels and rationing and all these things that aren't going to happen, we were able to change the public opinion of this, but not favorably, because we still have to do something about it. I think that once it's enacted and people realize, hey, this is not so bad, I'm not going to get denied.
But it was enacted in spring.
Anymore.
It's August. Look at those numbers.
Well, but it was enacted. That's the key point. It was a big, tough battle, and that's why it always has been. But the only way now, think about it, to use this ballot measure just to stir up some sort of political opposition, to repeal the law. Okay, let's say that you wanted to elect enough members of Congress that vowed they were going to repeal it. It would take supermajorities in both the House and the Senate. That will never happen.
Yeah. Well, that could be why they're going this route.
Well, I mean, that's a route, but are you going to elect that many people? Because I think at the end of the day, when people look at this, just like they're looking at how we fix the financial industry, and they look at the reform saying, hey, your kid can stay on health insurance till they're 26 years old.
I know, but
you don't get denied. All those problems.
I get it. You keep saying that as time goes by, people are going to love it more. I'm just saying that so far the numbers don't bear that out. What will be interesting is if these if more and more of these states actually try to take their own measures. They were? Nana, she loves her Social Security.
Yes, they were, and it was fought and went upheld, and people love Social Security now. So
Nancy, it's always a pleasure.
You bet. You too.
Thank you, lady.